the Police Oversight. I want to thank you all again for being here. Our first speaker for the evening will be Christopher Shorter, who has been Assistant City Manager in Austin since 2019. Prior to his move to Austin, Christopher lived in Washington, D.C. for 10 years, where he worked in public works, health, and youth rehabilitation programs. Christopher is here to set the stage for us to explain to us really the current state of COVID-19 in the city of Austin, as well as the shelter in place for. Mr. Short, I'm just going to turn everything over to you.
Very good. I appreciate that very much. Can you hear me okay? Am I loud enough? And
we've got you, Chris. Thank you.
Perfect. Perfect. Well, I guess what I want to do is just thank our team for pulling the group together tonight and for holding such a very important community forum around the virus and helping folks to demystify what is happening within our city and the county. I also want to thank the mayor and the city manager, as well as our city council members for just their leadership throughout this process. It's really meant a lot to see and to witness. I also want to just acknowledge and thank the county judge and all of the county officials. I know some you have speaking a bit later on this agenda. The way that this community has come together in the midst of uncertainty has just been absolutely amazing. And it is for all of us, whether you work for the government or you work for a service provider or you are a parent or a school teacher, this is a surreal moment for all of us. And so I just really just appreciate the fact that this team here at Measure is taking so much time and effort to pull the community together to talk about these issues. Just by way of sort of what the city and county are doing in terms of working together, I will say that for the last few weeks now, we have been officials from the county and from the city working, and from UT, the community college, AISD, just really across the board have been working together to make sure that we are prepared. Many of you all know that globally we've reached just staggering numbers in terms of the number of actual people who are COVID-19 positive. And for the last few days, we've been hitting scary numbers in terms of the number of actual deaths in the United States from COVID-19. And I will say there is a bit of a misnomer in that this is just a disease that's impacting older people or people with underlying health factors. That is not the case, and it has not been the case solely in America. That this disease is affecting young people as well, and that young people are carriers of the disease and impacting older and more vulnerable folks. In Travis County, as of today, as of this moment, I got an update about an hour ago, there are 351 Austin, Travis County residents at this point who have been confirmed as COVID-19 positive. This represents about a 15% increase from yesterday. And in terms of just the numbers of folks who are impacted by this, these are countless numbers because we're talking about families, individuals, extended family who are impacted by this moment, and anyone who has to suffer from this disease, whether they recover, they're in the process of recovering, or this has taken their life. There are a lot of people who are impacted. I will say from a response perspective, because I did want to touch on some of the work that the city is doing. And what I'd like to do is maybe after I'm done talking, I'll take some time and put a few links in the comments section to websites where you could find good information on the services that are being provided to support businesses and business owners, support families, support vulnerable populations, so our homeless population in particular. And so I just want to make sure that as I sort of go through, that folks have a resource and a place to go to get good information. And I'm going to put those up as soon as I'm done. As soon as I'm done talking. If you've been paying attention to the local news, you know that the city and county have worked through our Emergency Operations Center to bring online different modes of shelter for our homeless population. And so we are purchasing contracts with hotels to serve as essentially isolation facilities for COVID positive individuals. And what that means for folks not who are just homeless, but even those individuals who may have a home but not want to go back home out of fear of impacting their family. So healthcare providers, first responders, we are providing some support too. I'd also want to sort of make sure I made note that as we go forward, that everyone understands that this is just the beginning, and that there's going to be a lot of work that needs to be done to support our community as we recover. And I know we haven't talked much about that, but there's a lot that's happening in terms of planning around recovery, what we need to do to support businesses as they recover, and what we need to do locally to support individuals who need to stay afloat and recover as well. That said, this type of forum, this type of conversation, and certainly the fact that it's happening virtually, that we are changing the way that we come together as a community, and we're doing it via video conference, is extremely important. I'm sure many of us locally have seen the news stories of people out at Barking Springs or out playing basketball, out barbecuing in large groups. And I will say that this is not what we should be doing. And I want to just encourage the folks on the phone to encourage your family and your friends and your neighbors, if you see them, to let them know that we need to be home unless we are out doing essential business, that this is a time when we need to keep our communities healthy and our families safe. That said, I did want to talk for a second quickly about the stay-at-home order. I'm also going to put a link up to all of the health orders that have been signed by the county judge and the mayor, so that for those who are interested, you could go directly into the website where all of those orders are listed, and answers to some frequently asked questions. But generally speaking, that stay-at-home order here in Austin and Travis County mirrors what you will see really across the country. 90% at this point of Americans are under some form of stay-at-home order. Our stay-at-home order here in Austin, Travis County, really restricts movement except for those things that have been deemed essential or emergency. And so we want to make sure that those folks who are assisting as first responders, as healthcare providers and such, are still free to go to work. There are a number of other businesses and jobs that also fall under that definition of essential. Those activities like going to the grocery store, going to get medication from pharmacies, going out for a walk or a jog or to walk your dog. These are all things that are not impacted at all. We do want to make sure that we are practicing social distancing as we do those things. And so if we're running on the trail, which we see a lot of here in Austin, or in our parks, that we should be still practicing social distancing. It's extremely important. And so I'll also say, in terms of the stay-at-home order, many of you have also heard our police chief talk about the fact that we are not detaining or arresting individuals for not abiding by the stay-at-home order. That no one is being, or at this point, now that training has been done and the information has gotten out to our APD officers, that no one is being stopped or detained or certainly not arrested for unauthorized movement due to this stay-at-home order. So that said, there will probably be more questions as we go. I'm going to stick around here online. I want to say it again, and I'll keep saying it. I really appreciate the Measure team for pulling this together and making this forum possible for so many who may be really in need of clarity right now about what we're doing and what is being planned. So thanks a million, and I'm here to answer questions. And again, I'm going to follow up now with a few links. Thank you.
Yeah, thanks so much, Chris. We really appreciate that. That helps clear up a lot. And I'm really excited that we will also have Maya Guevara later to also help answer some questions about more information around police oversight and the shelter-in-place order. So thank you so much for setting the stage for us tonight. And Latrice asks if the links will be emailed that Chris is providing. And yes, we can send that all out. We are going to have Ricky Jones and Cameron Johnson on to talk, and just a little bit about them. Cameron Johnson has been practicing juvenile and criminal defense for over 25 years. He's the longest serving chief public defender in the state of Texas, and Cameron's been serving as the juvenile public defender in Travis County since January of 2001. With an office of 11 public defenders, the juvenile public defender is the largest and most experienced collection of juvenile lawyers in Texas. So we are really excited to have you today, Cameron. And also, I'll just say, since we're going to be jumping kind of back and forth with questions for Ricky and Cameron, I want to also introduce Ricky. Ricky Jones has been a member of the TCDA office since January of 2017. He served in the trial division and currently serves as director of diversity and community engagement, which oversees the juvenile division in addition to recruitment of attorneys and all community-based programs and events. So thank you both so much for being here. And we'll just allow a little bit of time to get them both on as speakers. This easy webinar platform allows for just a few folks at a time. So we've got to make sure that we're able to get folks off and get folks on, and just allow time for that. So I think that we have Cameron logging on right now, if I'm not incorrect. Cameron, do we have you on? Or is that Ricky that I'm seeing? I think we have Cameron on. So Cameron, okay, Cameron has no sound, but we can hear you. So maybe what we can do is log off and log back on and see if that works. And then Grayson, if we can have you try to pop off for just a second so that we can get Ricky on, that would be great. Thank you guys for bearing with us. This is just one of the fun little quirks of this new normal for us. I know that probably everyone has had stories of new adjustments that they've had to make during quarantine and during the shelter in place order that we've had, and offices switching to totally virtual. So lots of kinks to work out, but I'm glad that we can all do this together. So okay, I think that we might have our friends on now. Cameron, do we have you? Can you hear me?
I can hear you. Can you hear me?
I can. Yay. Okay, we got you. And how about Ricky? Ricky, do we have you on now?
Yes, I'm on.
Okay, perfect. And I don't know if we can get your videos on, and if not, we do get your beautiful pictures up here, wonderful headshots, by the way, so that's great. But yeah, we can go ahead and just start with getting some of the basics about what's going on in the juvenile justice world in Austin right now. So Ricky, if you can, I'm wondering what's the current number of juveniles in detention at Garner Betts Juvenile Center compared to what it was prior to COVID-19?
I think it's about 15 now, at least it was this morning. I think before COVID-19, it was in the 25 to 30 range. Cameron might have those numbers better than me.
Yeah, about a month ago, we were averaging probably about 35 youth in the juvenile detention facilities a day. And so we were right about, I believe, 15 youth in the detention facility, which is separate from we also have a residential program here in Austin. It's actually a regional residential. And we have, I think we have maybe about 40 Travis County youth who are in that program.
Okay, in addition to the 15 that are now currently in Garner Betts.
Yes.
Okay, got it. Awesome. That clarifies that for us. And I'm wondering, Ricky or Cameron, what has changed in terms of intake for juveniles in Travis County because of COVID-19, or what procedures are in place during that process?
Cameron, you want to go first?
I'm getting a little feedback, so I didn't quite understand the question.
And so, yeah, if you guys want to turn down your volume, I think sometimes that helps for the echo that sometimes happens with the video. But the question was really, what has changed in terms of intake for juveniles in Travis County because of COVID-19, and what procedures are now in place because of the crisis that we're under?
Sure, I'll be happy to start with that. First, I want to say is that, thank you, Alicia, and, Measure. This has just been a monumental task. I'm so grateful that you're doing this type of program and being able to get the word out because these truly are some trying times. It's something that, of course, I've never experienced, and I don't believe anyone else has experienced. But it's just been an incredible mobilization effort of the whole juvenile justice community. What's been different in the intake procedures is what the law enforcement has been working together, the district attorney's office, as well as juvenile probation. What has been happening is that there's been a dramatic limiting of the youth that are actually coming into detention. Fewer youth are actually getting arrested, and those who are getting arrested and brought into the detention, the juvenile probation department is really doing a just monumental task of interviewing them, getting in touch with the families, and seeing if they can come up with a release plan. For those that are able to get a release plan, they're required to have detention hearings. Then my office, the juvenile public defender, we've been working around the clock every day to work with the district attorneys and trying to staff these cases and see if we can come to some sort of an agreement with the juvenile judges to get them released without having a hearing. And if they are needing having a hearing, then we are actually having a hearing. This week we've been doing them telephonically, and it's been a challenge, but we've been circling the wagons.
Wonderful. Yeah, that sounds like a lot of efforts going in. And so unfortunately, Cameron, we're hearing that a lot of folks are not able to hear you right now. So we might try to see if we can bring you off and bring you back on, because you have a lot of great things to say, but we want to make sure that folks are able to hear you. So Ricky, a question for you. Do you know anything that the DA is doing specifically on both new referrals and existing referrals to keep those numbers so low in light of this current crisis?
One thing I'm doing is I'm reviewing every case personally. Every time, the first thing I did was I looked at everybody in custody a week or so ago and agreed to release or not challenge the release of anybody who I didn't think was a serious threat to themselves or to others. And basically everybody who didn't have a violent crime, I said let them go. If it was a close call, I was erring on the side of releasing them. Only people we didn't release was there were some a couple of kids in CPS custody. who had some challenges on making sure they had a place to go, and we didn't want to release them to the streets. Other than that, our goal was to release everybody. Unless it was a manslaughter or murder or some kind of serious aggravated robbery, I was err on the side of letting people go, whether they need a monitor or whatever. That's the first thing we did with the people who were in custody. With regard to the new people being arrested, unless it was a violent crime, we were just going to not contest them and ask that they be released. Of course, the ultimate decision is up to the judge, but our policy right now is to let them go. I know the probability of catching the COVID-19 inside and outside, I don't know what the statistics are, I don't know what the numbers are, but my philosophy, or my office philosophy, is that we would rather let the kids go and allow them to fight with their family to try to follow whatever the city and the county is doing to try to prevent them from catching this disease. With that in mind, we was the err on the side of letting them out as opposed to keeping them locked up. And I think working with Cameron and working with juvenile probation, I think we did a good job of vetting most of the people in there and trying to get them out of there. Some of the people in custody were waiting to get shipped somewhere, and they weren't true detainees. But I look at them every day. Every day they have to send me a list of everybody who's been detained, and we go over it every day in case we missed somebody the day before. And that's something that in light of COVID-19.
Got it. Wow. There's a lot being done there too, and it sounds like a lot of effort has gone into making those things happen. One thing that I'm wondering is, Cameron, I know there have been a lot of concerns from other districts neglecting cases in light of COVID-19 due to suspensions of visitation, courthouses shutting down, things like that. Can you talk about what measures you all have taken to ensuring you have their cases heard safely and efficiently, and what things look like at the Travis County Juvenile Courts right now? Some districts we know have moved to things like this, virtual conference calls, things like that. What has Travis County done in terms of those big changes? And Ricky or Cameron?
Because Cameron, I'll go ahead and say, with regards to my office, we have 6 attorneys in juvenile, and maybe 7 to 10 days ago, we started transitioning and then working from home 100% of the time. We had just our chief over there in the building kind of coordinating the work from home concept for our office, and now she's working from home as well. And along with the people over at Juvenile Public Defender and the Juvenile Probation and the Judge Hurley, they've created a system where all the hearings they do have are virtual kind of hearings. So for the sake of our people, they're not in the building as well. So they're able to protect themselves and their family, and also to protect the people who come in and out of Garden and Bed. So I think we're able to maintain the status quo in the system by working from home 100% of the time. And I think that by the joint efforts of doing everything we can to try to stop them at the front door before they come in, I think it'll be easy for us to maintain this, because there'll be a limited number of hearings. Because I think along with the police and the JPD and the district judges, a lot of kids that get arrested or get detained now, they're making provisions for the kids even before they get to our office on some of the nonviolent or some of the most simpler crimes, the low felonies and misdemeanors. So we don't even have to have an input on some of those cases. So I think that if we can do that, limit how they come in, then we can continue to work efficiently at home and not have people exposed to the COVID-19.
I can hear now. Can you hear me?
I can.
I can hear you as well, Cameron.
All right, great.
Okay, good. Did you have anything to add to that, Cameron?
I'm not sure where we left off.
Okay, that's fine. I know there were a lot of challenges there, but yeah, so it sounds like you all are doing a lot of work to just make sure that we're mitigating outbreaks, and that's what the concern is. So we know that we want to maintain public safety, and we also know that it's important to make sure that our youth are not exposed to
I'm sorry, I
potentially deadly virus.
can't hear you guys.
Okay, well, that's all right because we're about to move on to our next speaker. Thank you all for being here, and I hope that you'll stay on for questions at the end that from the community. So thank you so much. And now we're about to move to Michelle Deitch. Michelle Deitch is going to talk a little bit about best practice for addressing COVID-19 in facilities. So I know we've talked a little bit about how much work Travis County has done in reducing populations in Gardner Betts, and then we still have a lot of youth in those residential facilities. And Michelle Deitch is going to be a really great expert to speak to what we can do for preventing for really implementing best practices in facilities where kids are still located. So Michelle Deitch is a senior lecturer at the LBJ School and the law school, and she's an attorney with over 30 years of experience working on criminal justice and juvenile justice policy issues with state and local government officials, correction administrators, judges, and advocates. She specializes in independent oversight of correctional institutions, prison and jail conditions, managing youth in custody and juveniles in the adult criminal justice system. Deitch co-chairs the American Bar Association Subcommittee on Correctional Oversight and helped draft the ABA's standards on the treatment of prisoners. Her numerous articles about correctional oversight include a 50-state inventory of prison oversight models and many reports on juvenile justice that have received national attention. Her TEDx talk, Why Are We Trying Kids as Adults?, was named TEDx Editor's Pick in January 15. We are grateful to have you here today, Michelle, to share your thoughts on the state of youth justice in Austin. So thank you so much for being here.
Hi, everybody. Can you hear me okay? Because I'm
We
getting
can-
kicked off.
Yeah, I can hear you. If anybody can't, just sound off in the chat and we'll do what we can. Jeff says you sound great, so that's wonderful. And we don't have your video, but
Okay.
it's okay if that's a challenge. So no worries. We do have your picture.
Okay.
Perfect. There you are. Wonderful.
All right. Hi,
Thank you
everybody.
so much. Awesome. Well, wonderful to have you here. And I think that we'd love to just get some of your insight about guidelines and recommendations for facilities. You've provided extensive guidelines for adult justice facilities, and those were based on health recommendations, I know, from the CDC, from medical professionals. You provided those to representatives, to sheriffs, to other law enforcement officials. Can you just talk a little bit about these guidelines and how they could be applied to our youth detention facilities?
Sure. Let me run through this fairly quickly at a high level. I think you've already heard some of the great things that Travis County is doing. And I want to be clear that none of the comments I'm going to make are Travis County specific. These are really for institutions more generally. But it's good advice regardless of which county we're talking about. So first of all, you've heard that Travis County has made really big strides in terms of reducing the population of incarcerated youth. And that's enormously important. We need to be bringing down the populations for a number of reasons. First of all, because of course the kids would be at high risk of catching the virus if they are incarcerated because of the density of the population, particularly also because many of them do have chronic illnesses and such, but also because if they get ill, it is going to put a burden on the healthcare system that it's not really equipped to deal with. Because kids are coming in and out of the facilities, there's a lot of churn in these facilities, particularly in detention facilities. And so you want to, or if you don't reduce the risks of outbreak in the facilities, it's going to prolong the outbreaks in the community as youth cycle through these facilities and go back out. So that's, I'm not going to get into a whole lot of detail on reductions of the population, but the key points are to reduce the number of people coming in the front door. You've heard comments about that, not arresting as many kids, not bringing them there, diverting them beforehand, but also trying to get out the ones who are currently there. And again, it sounds like Travis County has been doing a great job of that. But switching gears now to the kids who are in the institutions and how could that be handled? The first objective is to minimize the potential for transmission from the community to inside the facility. Every person coming into the facility is a potential, what's called a vector for transmission of the virus. And all movement within the facility has the potential to spread the virus as well. So that's why we are seeing the suspension of family visitation, the suspension of volunteers coming into the facility, restrictions on most program providers and such, and the need to test staff, to screen staff as they come in to make sure that they're not, have not been exposed. All of that is critically important. The next objective is to reduce the risk of spread of the virus within the jail or within the juvenile facilities. And to be clear, this is going to happen. We need to just reduce the risks that it's going to happen and limit it to the extent possible. First of all, there's a lot of hygiene and sanitation measures that need to take place. For example, youth need to be provided with soap, free, it has to be free and readily available, hand sanitizer, and they need to be given cleaning supplies for their living areas. I am not sure if this is the case in juvenile facilities, but in many adult facilities, having some of those supplies is considered contraband, and that would be very problematic. Sinks need to be in working order. There need to be hand washing stations, more frequent laundry. Frequently touched devices, such as phones that are being used, need to be sanitized. Okay, then the next measure that needs to be considered is efforts to increase social distancing. And we all know that in congregate environments such as jails and prisons and juvenile facilities, social distancing is not a realistic possibility. The question is, how can we do more of it? One way we can do more of it is by reducing the population so that there's fewer people in that space. But think about the places where people congregate within these environments. In dining halls, you don't want to be serving people in dining halls anymore. They should be fed in their housing areas. You don't want people going to pill lines or going to the medical clinics. That could be done more at in the housing areas. You want to avoid the youth moving from place to place where they could be spreading the virus. In program areas or day rooms, you want to make sure that kids are being kept at a distance from each other. You still want to have recreational opportunities because they need to be burning off that energy, but maybe fewer people out there at a time and making sure that the equipment is sanitized between uses. Then the next measure we need to talk about is providing care, health care in suspected cases. How is that all going to be handled? How are sick call requests going to be addressed? How are they going to be prioritized? What kind of testing is available for youth who show symptoms? And if someone does show symptoms, where are they going to be housed? You don't want to keep them in the same housing areas where they will be exposing everyone around them. And this is going to be very hard for many facilities that don't have the space or don't have designated areas. But and the other important piece of this is not wanting them to be held in what amounts to solitary confinement. You don't want to create any kind of disincentive for anyone to be reporting their symptoms. So figuring out that housing is critically important. Now, many facilities are not going to have the kind of medical clinics that can deal with all of this. So we need to be looking at ways to bring telehealth into these facilities for particularly some small juvenile detention facilities around the state. And we need to make sure that every agency has a plan for how they're going to deal with any acute cases where a kid needs intensive care or acute care. What kind of a relationship is there with the local hospital, and how will they get there? What will that escort process look like? Okay, Now, the last thing that I really, well, two more things I want to get at. One is the importance, we're talking a lot about restrictions for the kids, restricting their visitation, restricting their programs, restricting their movement. At the same time that we're doing that, we need to be looking at ways to mitigate the harm that comes from those restrictions. If we're stopping in-person visitation from families, we need to be increasing phone calls and other forms of communication, making that free, creating opportunities for video visitation, for example. If we're stopping programs, we need to be looking at ways to deliver the programs through a different means, perhaps through tablets. And one of the greatest risks, we need to be aware that when kids become, when there's increased idleness, it's going to lead, and prolonged room confinement, it's going to lead to tension, it could lead to violence, and all of that needs to be mitigated through prevention measures, mitigation strategies. So another thing that staff need to be really on their toes about is emphasizing de-escalation strategies. They need to recognize that high levels of anxiety and tension among the youth and among the staff as well, that could lead to encounters that are problematic. Anything possible to avoid any kind of use of force or hands-on contact is really, really critical. So emphasizing de-escalation. The administrators need to be driving home during staff briefings. This is a time to emphasize kindness and compassion. We're all in need of that right now. It's a very, very stressful time for staff and for people in custody. So that needs to be emphasized. And staff need to be avoiding any kind of behavior that could increase anxiety among the youth. We need to be stepping up PREA precautions and enforcement, particularly at a time when there may be reductions in staff supervision, there may be understaffing because of staff being out with illness, and because sometimes that tension and anxiety and prolonged room confinement can lead to negative encounters between youth. The last thing that I want to talk about is the importance of increasing information sharing and transparency. The youth in custody do not have the same level of information about what's happening as people on the outside. There needs to be a lot of information shared with them about how they can best protect themselves. Also, families need information. Families have got to be so worried about their kids who are in the system right now, and they need to be given routine information about what's happening inside and what's happening to their kids. The agencies need to realize that as few families come in and few volunteers come in and few providers come in, and the ombudsman is not coming in, we need to make sure that that same information about what's going on inside is getting out to the public. There should be daily briefings. There should be tracking of COVID-related information, numbers of infections, numbers of hospitalizations, any kind of key indicators such as violence or use of force should be tracked and reported on a regular basis. So again, transparency is key, information sharing is key, mitigation of harm is critical. I'll stop there. Thank you.
Wow, Michelle, thank you so much. You're so right about transparency, information, all so important. And it's why we're here tonight. We want to make sure that everybody has all the information that they can get. The knowledge is power. We know it. Amanda says, Michelle, you are killing it. I couldn't agree more. Thank you so much for the thoroughness and everything that you have to share. It's really, really helpful. I think a lot of people feel more confident about what's going on now with everything you had to share. So thanks so much. We appreciate you. So now we will get to move forward with our next speaker. And I think that the community has a lot of questions for Judge Rora Martinez Jones, and I'll introduce her. So Judge Martinez Jones has also a wonderful bio. She's the appointed associate judge for the Travis County Civil District Courts. Her docket served children and families involved in a child protective service case at various court appointed levels. Some of the children on her docket are dual involved in both the child welfare and juvenile justice system. So we couldn't have anyone more appropriate to be here for this conversation. And I think that the judge will really highlight some of the answers that we need for the concerns that we have about what's going on with our youth in the juvenile justice system right now. So, Judge, thank you so much for being here today. We really appreciate it.
Thank you. Can y'all hear me well?
Yes, we can, or I can. If anyone can't, yes. Okay, we're hearing that we can. The only thing is we can't see you. So I don't know if you have your video enabled. There should be a little icon on the upper right-hand corner. If it has a one, oh, perfect. There you are. Wonderful.
There I am. Well, I just wanted to say thank you. I'm glad to be here and be able to take part in this discussion. I am very concerned about our community. I am a judge that's primarily in charge of the child welfare dockets. That's what I primarily hear, but I work very closely with our juvenile justice dockets, and we do have a lot of connections. And I have earlier this week visited with our lead district judge, Rhonda Hurley, over at the Juvenile Justice Center, and talked about what was going on, because we have been working very closely, as you can imagine, during these times. Child welfare and juvenile justice do not stop for a pandemic. So we're doing everything we can to continue and try and serve our community, serve the children, serve the families. I know when I talked to her about plans over at Juvenile for Court, we are all across Travis County working very hard as judges to set up Zoom hearings. So we're currently in the process of getting each judge set up with their Zoom accounts to be able to do hearings online and have as much inclusiveness as possible for all the people who need to participate in those hearings. So that is something that could be coming. I know that we've had a couple of different emergency orders that have been issued from our courts, and I'm going to drop here the link to the juvenile emergency order. And that has some information about how hearings are going to be occurring and some of the plans that are going to be put in place. I believe that they are going to be updating that even here soon to make sure that it's covering some of the questions that people have. I did want to say my understanding is that they are doing temperature checks on any new children, and any new children that have a fever are not being brought into detention. So I understand that that's one of the precautions that they're taking, not bringing in any new children that do have fevers, and they're trying not to bring any more children into detention. I also understand that they are doing multiple health checks of the youth that are in detention to make sure that nobody starts to show symptoms or have fevers or anything like that. I know Mr. Johnson is working on getting those protocols in writing, but I do understand that they are doing something like that at the detention centers and following the recommendations about the levels of cleanliness and things like that that need to be happening. I also know that one of the priorities they have is to set up education for the kids. With the schools being out, they work with AISD and are waiting on some regards for the plans that AISD are going to roll out, because their teachers are with AISD. But in the meantime, I know that they're getting as best prepared with technology and doing what they're going to need to do in order for the kids to take part in education as well. And so I know that part of the questions and the request for me to come talk was about those youth who may be in detention and may need to be released, but want to make sure that they're released into safe environments, into safe homes, to parents who are willing to take care of them and want them back. Between the juvenile justice courts and the child welfare courts, we've had protocols in place. If we ever have a youth who is in detention and really doesn't need to be in detention, if there's not a safe, healthy, sober parent or a willing parent to take the child back, or a person who can take custody, possession of the child, and help them maintain whatever additional requirements they might have while they're out. If we cannot find that safe type of home for them, there is a referral that's made over, and there's a couple of different ways we can do it. It's either a referral from the juvenile court to get a CPS investigation started as to what's going on in the home, or they also have the ability to do emergency temporary custody to CPS, and then that would bring the case over to either myself or the other judge who handles these cases, and then we would then make the decisions looking at it from a child welfare lens and not just the juvenile justice lens. We have a crossover docket. It's for dual involved youth who are both involved with child welfare and the juvenile justice system. And that is to hear both of the cases at the same time. So we're looking at all the resources, not just the juvenile justice resources, not just the child welfare resources, but looking at all those resources together to see how we can best support the child and hopefully bring the child out of the juvenile justice system and make sure we're taking care of them in a safe and healthy, appropriate way.
Wonderful. Thank you so much. That covers a lot of.
I hope that was helpful. I hope that was helpful.
Yeah. Let me ask one question that's coming in from the community right now, and I hope that you'll stay on for the end for more Q&A as well. There's one question coming in from Brett Murfish. She asks, the order you posted says that the judge is asking for attorneys to for a waiver of detention hearings, and how can we change that?
And so, like I said, I believe that is, there's going to be another order coming out, an amended order. And part of the issue is making sure that the courts have the capacity to also safely have hearings. And so my understanding is that they are going to be looking at doing the detention hearings, perhaps through Zoom. So there may not be the need to have to waive the detention hearings. We know how important those are. And so I think it's in the works. I am in regular communication with our juvenile judge, and I'm happy to take information back. And I told her I would about any community comments or questions or concerns. So I'm happy to have that kind of conversation, and I'll bring that up as well to make sure that the plans for the detention hearings, to make sure we're regularly reviewing and protecting the rights of the kids, to have that reviewed as whether or not they need to remain in detention. But I know that they really do not want to have kids in detention right now if they can avoid it.
Thank you so much. That helps a lot. And we do know, and Brett mentions that counties are doing Zoom. A lot of other counties are doing Zoom for those detention hearings. And
right.
So we hope that can also be
We're getting set up. We're almost there. I've had 80 hearings last week, and about a quarter of those or a fifth of those might have been through Zoom. So we've been on it and we're doing it. It's just a process to get everybody up to speed and trained, but we're working on it here in Travis County.
Wonderful. Thank you so much for all you're doing. We really appreciate your efforts, and we're excited that you're here tonight. And like I said, hope you stick around for the Q&A at the end. Thank you.
I'll stick around. Thank you.
Awesome. So next we have Maya Guevara. We are so excited to get a little bit of more insight into the police oversight and complaint process. I know that's what it said on the last slide. That was not the right verbiage for what that was. That was more about CPS transitional planning for our youth and juvenile in the juvenile system. So now we have Maya to actually cover police oversight and the complaint process. And Maya is the community engagement specialist at the City of Austin Office of Police Oversight. Her previous experience includes organizing alongside undocumented youth and families for education equity and against enforcement and detention. Her current work involves educating the community on the process to submit complaints and thank yous about interactions with the Austin Police Department and providing accessible Know Your Rights information to the community. So we're really honored to have you here today, Maya, to explain a little bit more about this issue for us, especially because there's been a lot of community concern around the shelter-in-place order. And our friends at Austin Justice Coalition did an amazing town hall last night where Chief Manley actually was there, and he said that instances of police searches for violating the shelter-in-place order, like Chris mentioned earlier, those shouldn't be happening anymore. Now the officers are kind of more aware of what the order actually means, but what should someone do? And more specifically, what should a young person do if they're stopped by police for violating that shelter-in-place order?
Yeah, thank you so much, Alicia, for that question and for the invitation. Just to kind of back it up a little bit and give some context about our office. So the Office of Police Oversight provides civilian oversight over the Austin Police Department. So that means that we are not part of the police department. We're not affiliated with the police department at all. We are completely separate and independent. We work for the city of Austin and report directly up to the city manager. And our office exists to monitor the Austin Police Department, to monitor APD's practices, policies, and conduct, and really provide, like I said, that independent civilian oversight over the police department. So that means that we offer a couple of different resources to the community. The first of which is that we are a resource to file complaints and thank yous about interactions with an Austin Police Department officer. So if anybody has any kind of interaction with APD, whether it's a positive interaction, it's a negative interaction, if somebody just has questions about the interaction, you know, was the officer allowed to ask me that? Were they allowed to search my car? Anything like that? That's where we come in. So you can contact our office. Anyone can contact our office. Our website, actually, I'm going to drop it in here as well right now. atxpoliceoversight.org, that's our website. So usually we take complaints in person, over the phone, online, and by email. Right now, we're not taking the complaints, obviously, in person due to the shelter-in-place order. We're working remotely, but we still are taking and processing complaints. Probably the easiest way to do it is online on this website. We have a complaint and a thank you form. But you can also contact us. All of our information is there to contact us by email or over the phone as well. And that process is very simple. The only things that we need to know in order to process a complaint are what happened, just some brief words about what happened in your interaction, where it happened, so an intersection or an address, something like that, and then the day. And if you have the time, that's also helpful just to help us narrow it down. But from there, we have complaint specialists who are dedicated to taking those complaints, and they have access to all of APD's dash cam footage, body cam footage. If there was a 911 call, if there was a police report, our office has access to all of that. And so our complaint specialists do a review and basically look at what happened and look at from the community about the shelter-in-place order and how it, and basically about enforcement and what APD's role in that is. And yes, it was an amazing town hall yesterday that Austin Justice Coalition put on. And yes, as Chief Manley said, and as our Assistant City Manager, Chris Shorter said, currently the order is not being, we're not at an enforcement stage with APD. So APD should not be, like you said, should not be detaining or arresting anybody, and should not at this point be stopping anybody, should not be asking anyone, you know, where are you going? Nobody should have to provide any proof about them being an essential worker, going to an essential business, right? And so actually our office was hearing a lot of questions and concerns about this, especially in the first few days of the order. You know, people say, oh, well, I heard, you know, my friend said that, you know, they were stopped and asked, you know, to provide a receipt showing that they came from HEB or things like that. And the chief of police has said that that was due to lack of training in the first few days, right? And so the police department has said that, and that should not be happening now. And so where our office comes in is just that if for some reason anybody experiences that they are being stopped, that they are being questioned, that's going to be really, really important for us to know. And so that would be where you can contact our office. The website I put in by phone, you can fill out the complaint there. Like I said, even if you just have a question about the interaction and you're not sure if you want to report it, but you want to know if what the officer did was true or was, you know, if they were supposed to do that, that is something that we need to know, because we really can't, we can only address what we know, right? We can't address rumors that we're hearing from the community. We don't, but we can address in instances where we're actually able to view the dash cam and say, yes, the officer did ask that and they were not supposed to, for example, right? And so I think the most important things, that's one of the most important things that anybody, youth or not, should really know about, being out right now, that you shouldn't have to prove any of that. And then another thing that our office provides is know your rights information, which again is something that I just always want to highlight, especially most importantly, probably the right to remain silent, that regardless of anything that, if you're pulled over and an officer asks for your driver's license and you have one, you should definitely provide that. But beyond that, making sure that youth especially are empowered to know that they don't have to answer really further questions from the officer, right, about where they're going. But that if they feel like the interaction didn't go the way that they think it should have, that there's recourse, right? That they can comply with what the officer said, make sure that they get out of that interaction safely, and then circle back, contact our office, and file a complaint with us.
Excellent. Thank you so much for helping clear some of that up and giving us really tangible tools to use going forward. And this, I think, will help mitigate a lot of potential just anxiety and any sort of negative interactions that might have happened, and also giving us just those that tangible link for what youth can do. That's really helpful for us. So thank you so much for being here, Maya, and we hope you'll stick around too for the next few minutes while we go through some of the questions from the community. So if that's okay, we're going to move into that portion of the webinar now. We've got some questions rolling in, and our speakers are so incredible, and they are already engaging in the chat right now with the community. So I really appreciate that. So a lot of questions have actually already been answered, but we've got a few that we can continue to work with, and I'd love to bring Cameron on, and let's also bring Ricky on. I think we have a couple slots, and let's see who else. Maybe we could also bring Judge Martinez Jones back on. I'm just trying to pick. We're trying to guess who we might have questions for. But we also have a couple of pre-submitted questions. So I'll go ahead and let's see who we've got on. Cameron, do we have your audio visual working right now? Can you hear me? Maybe not. Maybe we could take Cameron off, bring him back on, and see if that works again. So it seems Cameron loses sound when he joins, so that's too bad. We'll try again, but we've got okay, so we've got Ricky on, and that's awesome. I'm wondering if we can just, let's see, one of these first questions that we have here. Who do we want to? Yeah, okay, so Ricky, Judge Martinez, I'm wondering if either of you, while we were getting Cameron back, we've heard that an employee at Travis County Juvenile Probation Department tested positive for COVID-19. Do either of you know how many employees or even juveniles have tested positive or have been tested or are showing symptoms?
I'm only aware of one employee.
Okay, we're aware of one.
Tested
I haven't
positive.
heard of any youth.
No, you.
And I'm told that one employee was not working directly with the youth.
Okay, that one employee was not. Okay, that's helpful to know. Thank you. And Cameron just chimed in on the chat, and he says youth are not currently being tested. I know that it's a real challenge nationally right now to get a hold of those tests. So it's not surprising, but definitely disheartening that our youth are still not being tested.
Well, and
So
my understanding is that if a youth has a fever, they're being taken to the hospital. I don't know what happens from there, and I know hospitals aren't regularly admitting everybody or testing everybody because we don't have that. So, yeah.
Right. Access. Got it. Cameron says youth are having their temperature taken twice a day. Okay, so yeah, that's another question that's come in a lot from the community. How regularly are temperatures being taken? So that helps clear that up. And so we've also heard allegations that employees were ordered to continue to come to work until symptoms occurred. Is that true? Is that an answer that either of you or Cameron, if you want to chime in the chat, that any of you have the answer to?
I think that's a question for juvenile probation. I don't know what is currently their procedure, but I know in their part of Travis County. So I know in Travis County, we're trying our best to follow orders, but I do believe some of them would be considered essential employees. From the court's perspective, we're doing as much remotely as possible. So I've been conducting court from my home for the last 2 weeks. At juvenile, it's a little bit more difficult, especially with detention hearings, but I do know that they're being as remote as possible as well as far as the court process goes.
Got it. Thank you. Yeah, I understand. And we did hope to have one individual from probation on today, but we had some technical difficulties there as well. So I thank you so much for trying to answer those questions that might be a little bit out of your scope. So thank you so much.
Absolutely.
So we are also wondering, with visitation being put on hold right now, what, and actually I wonder if Michelle might be one of the best to answer this. And then Judge Martinez Jones, you might also be able to help with this one. But since visitation has been put on hold now, we're wondering what specifically Garner Butts is doing to help support the youth during this time of connecting with their families. I think Cameron might be able to help with this one too. We've spoken about this briefly earlier in the week. So sorry about that, Precious. She's doing some of the navigating in the background, but as these questions come in, we're going to try to roll with it. So maybe we could pull Cameron on to answer that one, or he could chime in the chat. But I know Michelle talked about some of the mitigation that could happen as tensions rise when we're stopping visitation and all these things for safety concerns. And so maybe some of the things that we can do to help support youth during this really, really challenging time that they're missing their families. Cameron, is there anything that you can speak to with that? I think I hear you typing, so that's a good sign. We may not have your audio. We did have your video for 1 second. Lost sound and video. Okay, so maybe he's not hearing our sound. Okay, that's fine.
And I don't know, there are a lot of limitations at detention, but I can say it's been an issue in the child welfare side as well, with parent-child visitation, even for kids that are in foster care. And so I know we're trying to explore different ways, and I know some suggestions we're sharing amongst all the judges about how we can do that. We're talking about the possibility for videos to be done for youth, letters, things like that, knowing that the face-to-face contact is much more difficult during these times. So those are all ideas that we've been sharing from the courts level. And I don't know as far as the advocacy who has brought up different ideas, but I always think that it's important that if we are able to come up with other ideas, we advocate for them really hard. Being former attorney defending children and interning in Cameron's office, definitely know they do a wonderful job coming up with all of those ideas and seeing what's possible. I just know that the juvenile detention situation is much more difficult as well, but I think that there's capacity since it is all local and it's Travis County. And so I think having those kinds of requests brought up and a community desire to make those kinds of things happen can be really important.
Wonderful, wonderful. Yeah, and I think you're right. From everything that I've heard from our speakers today, it does sound like there's a lot of creativity for thinking of solutions for our youth. So that's really gives me a lot of hope, and I'm sure a lot of folks here today. So I'm wondering, do we know if anyone is touring any of our facilities to check if some of the measures that Michelle suggested are being put in place regarding hygiene and things like that in some of these facilities? So I know Garner Betts, we talked about having a really small population right now, but some of maybe our other residential facilities and Cameron, I'm not sure if you can hear anything, but if you have an answer, you can chime in on the chat, and then I will vocalize that for the recording. But of course, Judge, if you have anything to share on that, I know that one is maybe a tricky one to answer.
Yeah, that's very, it's specific to the detention center, but I don't know how much they are having outside people come in, period. We deal with some of our local treatment centers for our foster children, and I haven't heard of that being done regularly as far as checking on compliance. I think we're in a place right now where we're hoping and expecting everybody is abiding by the orders that have been put in place by our local government and by the state, and that we all have our own best interests in mind to be able to follow those and actually make sure everybody's staying healthy. But as far as I've heard, and I've been getting regular updates as a public official about what's going on in the community, I haven't heard specifically that there's any compliance checks on those routine medical checkups and things like that.
Thank you. Thank you for that answer. And I'm wondering if we can bring Michelle back on for a question that one of our community members has. I think Michelle might be able to speak to this. It's a question a little bit about recommendations, things that maybe can be done that aren't being done now. And so Melanie has a question, and I can reiterate it once Michelle gets brought on, if she's not able to hear right now as she's getting pulled on. But Melanie asks, what can be done to advocate for the county to institute more liberal leave policies for detention staff? It can be tough for staff to decide not to come into work even if they're not feeling well. I think that this is something that's happening in all kinds of different work environments right now, right? Due to lack of paid sick leave, things like that. So the question is, what can be done to advocate for some of those policies to change? Judge, I'm sure you might have some ideas on that while we're waiting. Yeah, I'm sorry to put it all on you.
Something to say about everything, right?
Yeah.
What I would say about that is we do have a very active local union for our city and county employees that I know fight very hard for our county employees, because ultimately it does come down to the Travis County Commissioner's Court and our county judge with what happens in Travis County. And I would say if there's a desire to help advocate on behalf of the juvenile probation officers, I would start with our local AFSCME chapter, our local union who supports those workers, because I know they fight very hard and they're a great union to make sure we are taking care of everybody. And I know they're very active right now as well with everything that's happening.
Wonderful. Thank you. Awesome. Well, wonderful. I'm still seeing questions come in. Let me see what else we have. If we want to, we've got just a few minutes left, so I just want to make sure everybody's able to get their questions in. And that we've got all our speakers there's just a lot of questions coming in, so bear with me as I read through those. Nor has a great question about access, and so I'll wait till we are able to kind of get a speaker on here. I think Cameron would be great to answer this question. I think Michelle would be great to answer this question, but it's about access. And of course, any of you can chime in on the chat as well while we're working through some of the video issues. But Nor is asking what we can do to request more phone calls and possible use of tablets for youth. And I think that's a great question, especially regarding that question of what can we do? Because I think a lot of folks, and I just want to say thank you to our participants, by the way. We still have 63 attendees. I think we had over 80 at one point. So thank you all for sticking around. Wonderful to see all this engagement from our community, and then questions like this about what we can do. And I think this is so vital. Everybody's working so hard on this issue, and so asking our leaders what we can do to support is always such an important thing when we're going through crisis. And I know that they appreciate it, and I know that it's absolutely integral to getting things done. So I know that Cameron mentioned that when we spoke earlier this week that they're working hard to recommend that youth are getting greater access to tablets so that they can speak to their family and stay informed about what's going on. I also know that they are working on having more frequent virtual visits with the ombudsman in different facilities, since the ombudsman's not able to make those in-person visits right now. So all of that is going to help just mitigate that anxiety and make sure that youth get the information that they need. I see Cameron on now. Yes, I can hear you, Cameron. Did you have anything to add about Nor's question about increasing access to phone calls, tablets for youth?
Yes, that's a great idea, and that's something that we've been working with juvenile probation. They indicated that they had secured some Chrome notebooks to be able to use, but they haven't been implemented yet. As far as us attorneys, we're able to have phone calls, unlimited phone calls to our clients. And we've been working with juvenile probation to get more phone calls to their families, since there is no in-person visits, we're still pressing to be able to get set up so that they could get actually some video conferencing so they can actually see, their families, because those youth haven't been able to see that, and as well as us, we haven't been able to see the clients. We've only been able to talk with them via phone.
Yeah.
But I know, I think one of our associate judges has indicated that starting Monday, they're going to be using Zoom. So hopefully that they'll be able to get that back into the youth in detention so that we'll be able to have those video conferencing calls.
That's good. That's good news. And Cameron, will you just reiterate for everyone those numbers that we heard at the beginning of the call? Our pre-COVID numbers and our current numbers in detention?
Well, the juvenile detention has been averaging, let's just say in the last 2 months before everything hit, probably around about 35 to 45 youth in detention on a daily basis. Since COVID, and we've adopted these emergency procedures, I think as of this morning, the population is down to like 15. That's in the juvenile detention. As I said earlier, we also have a residential program, the Intermediate Sanction Center, and I believe that there's a total of 47 kids who are in those programs. That's a longer-term program. And of those 47, I believe 15 are from out of county, because it also serves as a regional residential program. So about 15 kids are from out of county, and the rest are Travis County youth.
And just as a last question, as we wrap up, do you think, Cameron, that obviously our community is still safe. We're seeing crime rates actually decrease right now. Do you feel like this could be our new normal, these low numbers of incarceration for you?
Well, it's something that we didn't just start pressing for these measures at my office, the public defender, and we've been having, advocates such as yourself and all of the other people who've been on this call, been advocating for that. Because if you got to understand, and so when we're talking about juvenile, let's just say juvenile crime and recidivism, this is not new. Juvenile crime has been decreasing dramatically for the last 10 years, not just in Travis County, but statewide. And so that's even with there's been an expansion in some of, offenses, but, we've been decriminalizing a lot of offenses. And so we continue to press for these issues, and, programs are being implemented to continue to reduce, because I say probably about maybe, not, maybe 5 years ago, one of the initiatives that we took with juvenile probation and the judges in here in Travis County is that we stopped detaining many youth who were being detained for technical violations of their probation. And essentially at that time, our juvenile detention dropped like in half overnight, where we were averaging probably about 100 youth on a daily basis. Last 5 years or so, that number there's been a dramatic decrease, in that. And we continue to work on programs because, we agree, I believe something what what Judge Martinez Jones said, detention is not a placement. It's supposed to be that, just a temporary facility. And those kids who are in juvenile detention, for the most part, haven't been found to have committed crimes. They are waiting, either trial or, disposition of the cases. And I will also say is that the average length of stay for those Travis County kids in juvenile detention is about 11 days. And we're doing everything we can to even reduce that because, kids who don't need to be in detention shouldn't be in detention.
Yeah. Well, Cameron, you have been amazing. Thank you so much for everything you have to share. And we really hope that we can continue this conversation. We love what we're seeing, what's coming out of your office. And we hope that we can invite you back for an update, hopefully on Zoom, a little more stable platform in the future, just to hear more about what's going on in Austin and with our kids.
Okay. Well, I'll be happy to. And I just want to give a shout out to, my other public defenders. I think they are amazing. They're some true gladiators, and, they're doing it because they, committed to doing it. And they're just doing an awesome job. And they've, since this thing is broken, they've stepped their game up, and, as all of us have, and we're going to continue to be able to work. So thank you for getting the word out and putting a focus on our juveniles in Travis County.
Yes. Well, thank you. Yes. Thank you all so much. And thanks to all of our speakers for being here today. You all are doing such great work. We really appreciate you. And thank you to our participants for being here tonight and for what you're doing in our community. We appreciate you. Hope you have a wonderful evening and a wonderful week.